Hello, welcome to workshop focused on medical devices regulation. My name is Merilin Varsama and I'm the head of health tech at Science and Business Park Tehnopol. And together with Estonian Health Insurance Fund, Enterprise Estonia and Estonian Health Board, we have organized these kind of workshops with a focus to support these companies during their MDR process. And today, as you can see, we have quite an extensive list of different speakers here from Estonia and also from abroad, showcasing different kind of support mechanisms and opportunities for the companies that could support them during this process. And if you have any questions for the speakers and also for the panelists, you can type these questions into the chat box, and we will try to ask these questions also from the speakers. But without further ado, I would like to introduce the first speaker for today, who is from Estonian Innovation Lab. And this is the Governmental Innovation Lab, and it's one of the first innovation labs, I think, in the world. Grete Elva-Jõemaa is the head of public policy and innovation at Accelerate Estonia and will introduce how they support companies with different kind of focus areas during this journey. Grete, the floor is yours.
Thank you, Merilin, and hello everybody from my side. So yes, exactly as Merilin already introduced, I represent Accelerate Estonia, which is a sub part of the Ministry of Economic Affairs and Communications. So we're the Governmental Innovation Lab. And our main focus is to help the companies who have encountered some kind of regulatory barriers. We help them overcome them by finding the right people in the right ministries, bringing them together with the entrepreneurs, working out a strategy how to tackle these issues, and then finally either changing a certain law or changing regulations or procedures or processes. So this is, and we do it also through piloting and evaluating all kinds of impacts that may come from these changes. So yeah, our catchphrase, I hope you see my slides. Our catchphrase is a pretty wild one. So it's let's make illegal things legal. And it's precisely what we're trying to do, not like in a bad way, but trying to open up a path for innovation to become a reality. Yeah, so virtually, I already talked about that. We try to be a test bed for innovation here in Estonia, and we have opened up our pipeline also from companies outside of Estonia, particularly the UK, as they unfortunately are not a part of the EU anymore. However, there are a lot of companies and medical device developers who wish to enter the European market, and the procedures there are just too crazy and too difficult to go through. So they're looking for ways here in Europe, and they have turned to Estonia because Estonia is known for its agile and flexible government and regulatory framework. So we look for novel solutions that have the main criteria is that there needs to be a regulatory barrier. The second criteria is that there has to be an economic impact for Estonia, and the third of all, it needs to be scalable. So those are our three main criteria for entering our program. And we do have a lot of different areas covered. So we don't have a focus area per se, so we're agnostic in that sense. And we have seen a surge in medical and health tech companies in the past like half a year. Our current project, just for instance, is regarding novel foods, which is surprisingly is surprisingly similar to the MDR certification process. Just fun fact. Then allowing self-service pharmacies, automated automated self-service pharmacies to become legal. Then some fintech, wastewater treatment, genome data, health data, and green claims standard. So those are some of the projects that we are working on today. But all in all, we are open to other areas as well and other projects. But what is our role precisely here in the MDR process is that, like I mentioned before, so I'm going to stop my slides here. Like I mentioned before, the problem with the medical devices is that it's a difficult process, right? And a lot of companies have turned to us asking for help mediating the procedure with the appropriate body here, which is the health board. So currently, we are in the process of trying to figure out the details and what can be done and how we can help. And on this Friday, we're having just a meeting. So the order of events could have been the other way around, because on Friday I'm having a meeting with the Ministry of Social Affairs and the Health Board to have this precise discussion. But all in all, if it occurs that there is actually a regulatory barrier that is so prevalent that needs like guiding through to make it more simple, then this is precisely where we step in to help this process. So my ask for you who represent companies, MDR, medical device developers, write to me and tell me what are some of the roadblocks that you face, and what is it that you possibly need help with within this process, because there are a lot of aspects, right? First of all, the classes, getting them certified appropriately, getting through the notified body as well. Let us know so that we would have a bigger picture, so to say, because Accelerate Estonia is founded precisely for aiming or facing the private sector and the companies who have these issues, so that we could help and talk to the government on your behalf. So this is very shortly a quick overview of Accelerate Estonia. My contacts, I can leave them here in the chat, but you can also apply on our webpage, and hoping to answer all of your questions. Thank you.
Thank you, Greta. As we don't have many questions yet, I think it's quite intriguing, this quote that saying, let's make legal things legal. So maybe you can explain more about the process of entering the Accelerate Estonia program, and maybe open up more about how this process goes for the companies. What is the length of the program? How are you able to get faster answers or replies for the companies that support in this MDR journey?
Yep, that's a very good question. So we have, since we are a part of the Ministry of Economic Affairs, we have a direct mandate to approach the government bodies with these kinds of problems and bring those into the attention of undersecretaries and heads of the units, and escalate it up to sometimes even the ministers. So this is one of the first steps that we take, is that when you apply, we validate the information, we validate the issue that you turn to us with, and seek some answers already, some initial answers from the appropriate institutions and ministries, with so as to validate whether or not there actually is a regulatory barrier, and then come up with some sort of possible solution. So the program usually lasts about a year, sometimes more, because the process is slow. There's nothing to hide here. It's we're dealing with the government, right? So the process is slow, whether you like it or not. But without us intervening, or at least this is some of the feedback that we have gotten, is that if Accelerate Estonia hadn't intervened, then the idea or the innovation hadn't gone anywhere, or like hadn't they would have been stuck indefinitely. So this is our aim, is that it might take some time, but eventually we'll work out the strategy and test out the solution, and we'll work out the strategy actually in the very first big part, and then test or pilot the idea or the technology, and then gather information and data that we can then present to the lawmakers and say that, hey, look at the data is all there. This supports the hypothesis that this law needs to be changed in order to open up a new market segment for these types of companies, and the possible revenue for the state budget is XYZ. So this is the data that we offer to the ministries and the lawmakers. So we serve as like for the government, we serve as the middlemen, so that they sort of don't need to allocate their precious time on like the additional workload of assessing these types of issues themselves. And for the companies, we are the first line of defense or offense that can try to break through these barriers. So yeah.
Mm-hmm. But maybe you can also showcase for the companies that are attending today's workshop. So what are the requirements for a company to enter that program? So maybe you can point that out as well.
Yeah, so like I already mentioned, you need to have, first of all, figure out whether the issue that you're facing is a regulatory issue. If you don't know, that's okay. We will help you figure it out. Maybe initially, just to say that it doesn't. We can't help companies that are whose product is in an idea phase. So you already need to have something tangible, right? for us to pilot, because we do allocate funds for piloting, but this is only for research and development, and not so much, or not even a little bit, for product development. So this is something that you need to keep in mind, and then provide us with some of the economic calculations, how probably all of you have done some initial calculations on possible revenues and market growth. So all of these help us pitch the idea to the government as well. Apply when you apply through our webpage, then you have to fill out the fields, and we will assess those immediately virtually, and get back to you with feedback.
Mm-hmm. Is there any differences? So do you take only in Estonian companies, or also companies from European Union can actually attend this program?
Yeah, we accept companies from outside of Estonia as well, but our focus country currently is the UK. So those are preferred, but we won't turn down anyone who turns to us.
All right. And maybe just a final question for you as well. So I know that you have quite some companies in the program at the moment that are focused on digital health and that are in their MDR process. Maybe you can also point out the biggest challenges these companies are facing that they want support from you, from Accelerate Estonia.
So one of the things is really getting the documentation getting the documentation ready, and doing the tests and piloting, and getting the documentation ready for submitting. So there has been problems with getting rejected from the notified body because the documentation has not been validated properly. So this is one thing, and so one of the companies that is in our pipeline currently, so they have a physical device which is class 2, but they also have sensors that are class 3 in their core, but they don't wish to apply for a class 3 device. So how can they, or what they need to do in order to stay class 2, but then not physically remove the sensors, and so these types of questions. So some of them are bigger, some of them are more detailed, like the last one.
All right, thank you a lot. So Greta will leave her details in the chat box, and if you have any interest in applying for the program, you're very welcome to do so. And next up, we have also a representative from Enterprise Estonia talking about applied research program. And I'm very happy Reet Reinart-Okupeni, who is the R&D expert at Enterprise Estonia. So the floor is yours.
Thank you very much. And I'm very happy to be part of this training session to share more about our applied research program and how we can help fund companies on their medical device journey. So maybe the easiest to describe what this program is aiming for, we are aiming to fill the gap of funding in this valley of death, if you've heard of it. So this is the red line here that you see that at one point there is not enough government funding or private sector funding to get the innovation out of the lab to the market. And in this image, you can also see that it is tightly connected to this product development lifecycle, where in the early phases you have funding, and then at some point the risks of and the cost of the development is so high that the private sector is not yet ready to invest in your project. And then we come in with government funding, and we help mostly small and medium-sized businesses in this journey, but we don't also limit it to only small and medium-sized. So what does it mean in more specific terms? With this funding, our aim is to enhance the spending in R&D activities financed by the private sector. You will see later how we enhance it with the private sector. We also aim to expand the number of entrepreneurs dealing with R&D activities, also the number of people involved in R&D activities in those companies. And we also promote exchange of knowledge between entrepreneurs and R&D institutions, universities, and so on. With this program, we also focus on increasing intellectual properties of companies, so the value of their innovation has more future out in the market. Also, we see that through this program, we can also increase the earning of R&D institutions who are providing services to private sector through this program. Overall, the aim of this program is, of course, to increase export volumes and stimulate our economic growth. And with this program, we do have some focus areas where we support projects, and these are defined in the National Development Plan for Research and Development, Innovation and Entrepreneurship, which is currently valid until 2035. And there are 4 key categories of focus areas: digital solutions, health technologies, valorization of local resources, and energy solutions. In the context of this training, we can focus more on the 2 categories. In digital health category, we are both working with health technologies, but also with digital solutions. And in the terms of health technologies, the aim is to have more effective and accessible health services, more patient-centered and evidence-based treatment and prevention services, also increase export potential on the healthcare system. And among the digital solutions, very important aspect is secure cyberspace within those digital devices that are developed. And if you ask whether your project applies or qualifies for our program, then as a previous speaker already mentioned, we also look at your business plan. Do you have a good strategy? Do you have a really qualified market demand? Do you have the expertise in your team for R&D, for business, for regulatory and financial part? And whether this activity is actually an R&D activity, because in our program, we do support R&D activities. And how to determine whether what you're doing is qualified as R&D, you can think of these 5 key criteria that have to be met at the same time. The project has to be novel, or the solution that you're developing has to be novel. The way you address this problem has to be creative. You find new solutions, how to approach a problem. There must be several aspects of risks involved. As you saw that in the first slide, when talking about the valley of death, this is the riskiest part of your product development journey, where the cost might be high and not many investors are ready to invest. So what are the risks that this project actually is successful? If you're very certain that everything goes according to plan, then it's probably not very risky business, and probably one key criteria is also missing. Systematic approach, this is something that we look at, like what are the methods that you are using during the product development or R&D phase. How do you reach your goals, basically? And how do you quantify your success? And transferability here can be considered developing intellectual property during the project. How do you transfer the knowledge that you developed during this project? You should look at also technology readiness level. In the first graph, you saw that we are funding the gap, the death valley, and this one is in technology readiness levels between 3 to 7. So think about what technology readiness level is your product now, and where do you want to reach with this use of applied research program funding. And also, when it comes to medical devices, it is clear that you already are in the strategic area of interest, health technologies. But yeah, this is also important. We only fund projects which are in the higher focus areas. So what do we fund? We fund different kind of activities like feasibility studies, but only in combination with applied research and experimental development. And here you can see why these technology readiness levels are also important. Applied research stage is what is defined with technology readiness levels 3 to 5, and it has a higher funding rate. When you reach further in the product development life cycle, then experimental development is at TRL 6 to 7 and with a lower funding rate. You can also see that there are differences between small, medium, and large companies, what level of funding they can get depending on what stage in the project they are applying for. And there is also a difference whether you partner with some external partner. It can be another private company, or it can be a research institution who is partnering with you officially. And there are certain terms also that apply to this effective cooperation partnership. The main thing is that both partners need to bear some of the costs of the project to be eligible as effective cooperation partner. I already talked about the relevance of the TRL level that you need to define when entering the program. In case of medical devices, there is one example here on the screen. Maybe the easiest is to determine these milestones from moving from TRL 5 to TRL 6. So anything preclinical is up to TRL 5, and when you move to clinical phase, it's already TRL 6. So this is just a small guideline how to self-assess the technology level of your device. Also, the classification of the device by appropriate regulatory body this one is normally, the earlier you have it, the better for you, because you can follow all the required requirements in terms of documentation and so on. But at least TRL 5, you must have very clear understanding what class your device is. So a bit more about the specific funding programs under RUP, like we call it. So RUP stands for Rakendusuuringute Program, Applied Research Program, and throughout you can see this RUP everywhere in the presentation. We see mostly companies applying for the big funding, big RUP, and small funding, mini RUP. The difference of those two programs is that in the big group, you can get up to 2 million euros funded by us. And it also means that you have to have self-financing for this, depending on what stage of the product technology level you are applying the funding for, and the size of your company, and the effective cooperation conditions that I talked about before. The B Group program is open for applications twice a year in spring and autumn. Currently, we are on the 6th call, which ended in April, and we are in the evaluation phase. So by midsummer, we have results out for the 6th call, and the new call opens up around September. If you want to join the next call in September, then you should already contact us and start pre-consultation, because this can be quite long procedure to get your project to a certain level that it can actually compete well. The B Group is a bit different from the other programs that I share, because we have several rounds of assessment of your project, and the last assessment is done by a committee, and therefore there is gonna be like a list of companies, and the better points you get throughout the assessment rounds, the better chances you have to get the funding. The small group is a little bit easier in that sense. The funds that we allocate there are smaller. The rest is pretty similar, the self-financing and all the rest part. You can submit anytime, but also pre-consultation is a mandatory step, so that we can make sure that your project, before it arrives in our website on the e-system of support system, before that we have made sure that your project is viable and competitive. From Minirup, you can actually get your results whether we approve or don't approve the project for funding within 1 to 2 months already. And there is one limitation for small group program, is that you can submit, or actually you can get funding for one project per company within 3 years. For the B Group, you don't have this limitation. You can have as many projects, active projects with the B Group as you can. There is another program for Ida-Viru County and enterprises who want to bring their business to Ida-Viru County. There are a bit more conditions that if you want to hear more about them, then also come for pre-consultation. Let's say the competition in this program is definitely lower, because not so many companies are operating in Ida-Viru. So if you see something like that, that you want to invest in this region, then come to us. There is also a pilot infrastructure grant available for Ida-Viru. There is another infrastructure grant available, which is not limited to Ida-Viru County, but this is supporting companies who want to offer services, research and development services to other companies or whoever. Similar conditions as with the Ida-Viru County self-financing 50%. If we look at the projects that are funded by RUP, then e-health is among one of the big bubbles. So the size of the bubble shows the volume of the investment in the project. We can already proudly say that we have supported 150 companies who have invested with the support of RUP as well. We have invested up to 170 million euros, out of which 100 million came from our funding. Just very briefly, also to show startup companies are a very big portion in the Minirup rounds, but also in the big rounds. And health technologies in general are among the top players in our funding programs. And here is a quick list of companies that have already received funding which relate to this program here. E-health and medical device related, you may know companies like Activate Health, Better Medicine, and so on. And last week, we also heard the case study from Synbase, who shared their journey to MDR. And for more information, you can go to EAS website and find all the other funding opportunities. What is good to mention is that two companies that passed successfully RUP project, GeneCode and Better Medicine, also got funded by EIC Accelerator, and RUP program is also the official plugin program for this EIC Accelerator. So if in case you have successful RUP behind, then you can get the easier route to funding by EIC. Come for pre-consultation, so spare time. It might take 2 to 6 months to fine-tune your project depending on the complexity of the project. And once you get green light from our experts, you are free to submit your application in our system and wait for the funding. Last but not least, next week there is an investor speed dating event taking place. So if you're trying to look for another type of funding sources, please join this event as well.
Thank you, Ret. It's actually great to see also that these companies that have received the RUP funding, most of them are in our community as our community members. But unfortunately, we don't have more time to ask questions from you, so you can leave your details also in the chat box, and we can share also the presentation that was presented today. Thank you a lot, Ret. And next up, we have the Estonian Health Insurance Fund, and I'm very happy to greet Kristin Kuusk, who is the innovation specialist there, and she will also showcase you what are the opportunities that the Health Insurance Fund is providing. And the floor is yours.
Thank you, and hello from my side as well. I'm Kristin, and I work as an innovation specialist at the Estonian Health Insurance Fund. And today I will briefly talk about the innovation grant. To start off, I think actually a large part of today's presentation focuses on disclaimers, as in understanding where does the Estonian health insurance fit in the healthcare ecosystem, because I think it's really, really important to understand that whatever we do as a health insurance fund, we are doing it in cooperation with other parties in the healthcare field. So as with the previous presenter as well, it's important for the health insurance fund that there is alignment among these different mechanisms, and that in order to have a good healthcare system and provide people with access to healthcare services, there is alignment among these different bodies that I have brought out here. And I think it's really, really important to emphasize it because in the past 4 years, Estonian Health Insurance Fund has taken a new role as in being more active in the healthcare innovation sphere. And with new roles, it's really important to ensure that whatever kind of responsibilities we are taking, we're not taking over other parties' responsibilities who are quite literally the experts in the field. And just to illustrate this, it is in Estonian, but how does the healthcare ecosystem look like, and what are the different parties in it? And I think the key thing here as well is, although it's a really, really pretty picture, alignment among these bodies does not come just if you write it down. The alignment comes with hard work and continuous work. Right. So I will be talking about the innovation grant, but before, again, I will kind of set the scene when it comes to where does the innovation grant fit in? Where do we position ourselves? And these steps that I will bring out, the process is definitely not something that the health insurance fund is solely running or responsible for the whole process, but just to illustrate what might be the different steps. So you have a new idea that you would like to develop in the healthcare field. What to think about? Key first part most definitely is that if you have a new idea, a problem that you would like to solve, perhaps you should check in with your target market, have conversations, interviews with different clinicians, patients, and so on and so forth, to make sure that you're validating the problem, that you are solving a problem that needs solving from the target market point of view as well. And with each step, again, this is just a recommendation what to think of or where to get some type of information. In the new idea phase, it's also really good to kind of look into different public development plans, as in what, for example, is this health insurance fund planning on doing? How does the next 5 years look like? Other thing is, if you're operating in the healthcare field or wish to do so, again, how does the health actually look like? What are the main diseases that take up majority of our healthcare budget? And more moving more towards research part, PubMed is always a really good place to start looking into what other type of studies have been carried out. It's a good reference point for us as well in our daily work. Right. So you have your new idea, you've validated it with your target market. Where to next? You found out that it's worthwhile idea and moving into the product development. And here in this phase, I've just brought out what to think about and what other guidelines that you can keep in mind. Just recently, actually, a couple of months ago, the Estonian Health Insurance Fund developed an official care pathway development guide. So, for example, if you're developing something that you would like to see implemented in a care pathway, always a good guide to look up and see what to keep in mind whilst you're developing your product. Right, so on to the next step. If you have the idea what you want to do, I think with digital products, we will never get and should never get over the security part of it. I'm from this side, I'm really talking about the information technology security part. Is whatever you're developing actually safe? Can we trust it? Here, I'm not gonna go in depth whatsoever, but a good point of reference, if you are a medical device, are the various ISO certificate guides that you must get if you're going down the medical device route anyways. And something that the Health Insurance Fund is slowly planning to introduce and implement is actually our own technology assessment criteria. I'm not sure how well people know the UK NHS digital technology assessment criteria. Basically, it's a framework that's meant for technology companies, but also the clinical users as well, with specific, as in guidelines, like what does your product need to meet, basically. And it's really focusing on the data protection, cybersecurity, and so on and so forth. And the Estonian Health Insurance Fund, we have slowly been piloting this extra assessment criteria in the primary care field, where we are introducing additional digital channels to reach out to your primary care doctor. So again, Here, as you're more in the development phase, these guidelines are meant as in like, just keep it in mind, like, so you will actually develop a really good product that has a really good secure technical packing as well. Great. So you have some type of product, it's a good product. Now you actually need to find out and carry out various studies to show the benefits that you hope to give whilst introducing it into the healthcare field. And I think my presentation fits together really nicely when it comes to feasibility studies with the previous speaker, as in that's something that a company can apply via the RUP funding mechanism. And from the health insurance point of view, a good guideline, what to keep in mind in this feasibility study is the, again, UK NHS NICE evidence standard framework. It gives you quite nice like tips. So if you're running your first study and you want to show that you have a really good product, what do you need to keep in mind? How should you design your study? And I think the key thing here as well is that there might be a need to carry out quite a lot of feasibility studies, but the main point is also to show through this feasibility study that whatever product that you have developed, there is interest and usage among the target group. So basically you're just testing it out in the intended environment. Right, so let's say from the feasibility studies, you have managed to get quite good results, as in that there is a possibility to have good, great health impact benefits, as well as economic impact benefit. And from this point of view, I'm really talking from the health insurance point of view. As in, let's say that you have a new good product, what might be the saving if we implement this new product across the country, basically? How much can we kind of predict or budget that with introducing this new product, how much we might save on healthcare costs? And from the guidelines point of view, here, as we are operating in the healthcare field, we cannot come over what is the current golden standard, and it is a clinical randomized trial, just to make sure that you have gathered really, really good evidence and to back it up that if you have a product, that it actually has the promised benefits. And the economic impact assessment guides, that's something that I'm referencing here that is available in Estonian, but it's available on our webpage as well. In the end, I will just have all the links together as well. But again, what to keep in mind, like how do you define like what is cost efficient and what data needs to be gathered, basically. Right, so we have reached the last step, which is then the permanent listing. All these steps should, at least based on your business plan and business goals, if you wish to have this permanent listing, meaning that it's on our healthcare services list in Estonia and the health insurance fund is covering some of the costs. That's what you need to keep in mind. And here again on our webpage, there is a checklist, what to keep in mind or what type of evidence is needed, basically to submit this, make a proposal for the committee who then decides like, is this good? And should it be added on the permanent list? And then on the last part, as I spoke about it again with the technology assessment criteria, here on the third step, basically, it was meant as a guiding principle, what to keep in mind if you're developing your product. But here now on the last step, we see that then an audit needs to be carried out as well before entering the permanent listing, basically. And this is again meant as that we as the health insurance fund, we will get the security that this product is secure, it has good health benefits, it has a good economic impact, basically, and to cover all the necessary basis, basically. Right. So, as I said, the disclaimer part, I think it's the longest. Where does the innovation grant come in from the Estonian Health Insurance Fund? It comes more heavily in the last steps, basically. And as I said as well, from the feasibility studies, you have received some type of evidence that this is good, it's worthwhile to investigate it further. So then that's where the innovation grant comes in. The aim from the Health Insurance Fund is to use the innovation grant to then expand the range of the health services that then aim to increase the people-centeredness of the healthcare system, improve health outcomes, support people in maintaining their health and prevent disease, improve the treatment journey, and ensure that service quality and availability the conditions are in place. Right. If you see that you have already gone through these different steps that I described and see that the innovation grant might help you reach further and you would like to apply, what are the specific conditions? The main purpose of the innovation grant is to obtain reliable real-world data about the new service model's effectiveness, cost efficiency, and ease of use compared to the current best practice. And what is it more specifically? It is really directly meant for full service models. So it's really, really important that whatever this new service is, it's not only focusing on a digital product, but there are additional services around it. And it really comes into play when we're talking about the future and the actual implementation. You need to think through the various steps that if you have this product, okay, great. How will the patient's pathway basically change or not change, or what will be the impact? What type of consultations or actual doctor's visits are involved, and so on and so forth. Who can apply? All legal entities, so hospitals, private companies, GPs, etc., etc. Team conditions. We have set the team condition that basically additionally for the team lead, you need to have at least 2 partners. And one of these partners needs to be the PI, basically, so the primary investigator, again, when we are going back into carrying out studies. How much? As with the previous speaker as well, the innovation grant does not cover the cost 100%, but it's up to 65%. So it does mean that the teams need to have at least 35% of their own funding to apply. And something important to bring out is that with the previous workshops as well, we have spoken about the different ISO certificates, and that the first ISO certificate basically on the medical device path is the quality management one. And what we have introduced in the innovation grant is that, let's say that you are a company, you have gathered the good evidence, but you do not yet have a CE marking, because as we all understand, it's a really long process. But how can you come to the innovation grant? If you don't have the CE mark yet, then at least you need to have the ISO certificate that I have brought out here. And I think previous speakers in the previous workshops have covered it quite nicely. And I am summing up, I am reaching the end. These are basically the various guidelines or point of informations that I mentioned. I can also put it in the chat and whatnot. And I mean, just as an FYI, they're all in Estonian. So unfortunately, the English version still needs some development. But thank you very much.
All right, thank you, Kristin, for the great overview. Also, these materials will be shared with all of you who is listening here now. Unfortunately, we don't have time for questions, but next up we have our collaboration partner from Belgium here, and Fabrizio Giannotta is actually an MDR expert working in WSL incubator, which is the first European technology incubator founded since 2000s. So he will also explain what are the opportunities and supporting mechanisms for companies and also for companies that are outside of Belgium that can enter and take part of these opportunities. So Fabrizio, the floor is yours.
Thank you very much, Marilyn, and thank you very much for giving me the opportunity to be there with you today and to present you as well as the incubator, but also how we are supporting our entrepreneur in the journey through the MDR and through the market. So, as mentioned, I'm Fabrizio. I'm one of the business coach of this incubator structure, and I'm dedicated to support the medical device project. But within the structure, as I present you, we also are campaigning a lot of different projects related to engineer. And so I will give the opportunity to present you very briefly what is the incubator, what WSL is, and what we do for the entrepreneurs. So, as it was mentioned, WSL was established now 24 years ago. This is a long journey, but we don't explain all the different steps during all of this year and just focus my presentation on the medtech, on medtech and the things that we do for the medtech, especially the TRL booster. Okay, so let me very briefly introduce what is, or better, what is not WSL, because we are not a conventional incubator. We know have office and we know rent a square meter because we support our CEO and the project on a daily basis. It means that we support the entrepreneur in 360 degree. It means the different aspects that it is need to manage a company. We do not invest money in this company because we are completely independent with no financial interest in this company. It's very important for us in such a way that we are not implied, let me say, financially in the company, and we can provide advice with no financial link, let me say. There is no discount option or further funding series. It means that, once again, we are not interested to have shares in the company, and so we want to free our CEO for any kind of obligation, which is very different, let me say, compared to other incubator, because sometimes some incubator wants to have 20 or 10% of the share of the company only because they are coached by this incubator. This is not the case of WSL. This is not a short-term campaign. We support our company for 3 years plus 2 full 1 years. It means maximum 5 years for startups and maximum 7 years, 7 years for spin-off, which is in fact some project coming from the university, as you know. We are not only focused on business plan and financial plan. We are not focused only to help you to pitch in front of investor, because as I mentioned, this is a daily basis support in 360 degree. It means that thematic as HR, regulatory, strategy, marketing and sales, etc. So all the aspects that you cope with within a company can be discussed and can be challenged with us, and we help you to go through all of these aspects. This is not just one contact person. As I mentioned, I'm one of the business coach within the WSL structure, but I have 7 other colleagues which different expertise, and we are all senior within this expertise because we come from a very large company, or we have managed our own company, as it is my case, in a biotech field. We are not agnostic. We are agnostic because we are focused only on projects that are deep tech engineer related. It means that this is mainly large, but focus only on projects that are related with engineer science, and obviously medtech have a large component of engineer within this project. So it means that we contribute to the development of new industrial landscape within the Wallonia, and we want to retain talent in the field of Belgium, and particularly in the Wallonia. Particularly in the Wallonia, because we are fully funded by the Walloon region. It means that sometimes we need to have a return on investment of this in this country. As I mentioned, we try to help entrepreneur and company, not only medtech company, to go through that journey, to grow within a very competitive landscape which is not only in Belgium, but all over the world, because all of our company are international imply. So we really try to do the best to go further for the company to sell their product or their services. As I mentioned, we are focused on engineer-related project, but within all of this project, which is coached by WSL, we can see that we are implying electronics and mechatronics in this industry 4.0, also in green tech and clean tech, ICT. And as you can see, many of our projects, 22 in this year, are related to health and medtech. This is the reason why we have established a program to help those companies to go further to the market, and I will explain this program in the forthcoming slide. Okay, we can pass that. Because many of our companies are related to the medtech ecosystem, we are also now managing Medtech Wallonia, which is in fact another structure in parallel of WSL. And our mission within this Medtech Wallonia structure is to establish and organize the medtech industry sectors, to fostering networking between diverse actors. Actors means that obviously there is a company that are dedicated to develop a medical device, but you have also hospital, you have surgeon, you have also a lot of companies that are not medical device dedicated, but they can support medical device companies such as microelectronic, plastigists, etc. The third mission is to help company to apply for EU grant. So in that case, obviously we can make a consortium with Estonia to apply for EU grant with Belgian company as well. We have developed a lot of different tools to help and coach our company, but let me introduce you very briefly the MatMax matrix. You have learned about the TRL level, but there is also a CRL level, which is related to the commercial maturity of a company. And using this matrix, you can evaluate the maturity of your company, not only on the technical level, but also on a commercial level. It means that more you are advanced in a technical level doesn't mean that you are advanced to sell your product. So this scale enables you to understand how deep you are to sell your product in the market. Are you in a demo level or proto level, or do you have right now a product to sell to the market? So this maturity matrix helps you to really define where you are in the selling of your product. Obviously, the best way to go to the market is this straight line, but unfortunately, this is not always like that, and especially with medtech technology. As you know, when you start from an idea and put your product within a human, this is a long journey in which you have different steps to go through, and some steps are particularly difficult. These cartoons, sorry for that, it is in French, and I've not the same cartoons in English, but these cartoons depict the different step, which is particularly difficult for a company to go through. And once again, sorry, this slide is in French. I have no time to translate it, but it is only to show you that let me say, the translation of this cartoon in a different step to go to the market are particularly difficult. What we observe for the medical device development company is that you have a long journey here, which is particularly dedicated to the technical level before going to the market and make your first sales. So we are here in the maturity level. So it means that during this plateau, you spend a lot of time and a lot of money. And so let me say, there is a high risk for your company to fail during this journey. This is the reason why we have established a program named TRL Booster dedicated to MedTech to better understand where are the stumbling stones and to help you to anticipate the stumbling stone, anticipate the problem you can be faced with during this particularly difficult journey. Let me share with you some tips and tricks regarding the fact that we have identified some stumbling stones that are particularly important during this journey. The first one is to well identify the intended use, of your medical device, because well identifying this will define the class in which you will have and the path that you will follow to go to the market and go through all the journey to develop your medical device. The second one is to establish your QMS, the quality management system, and also the ISO, which is related to the MDR. It means that this is the 13485. I'm sure that you are familiar with this ISO certification. Another thing that we observe as a stumbling stone for those companies is the risk management and the risk control, which is related to the GSPR, the General Safety and Performance Requirement, which is also very important during this journey. The next one, obviously, will be a clinical evaluation, because you have to demonstrate that your product is safety and give an advantage or any kind of benefit to the people or to the surgeon, okay? And finally, last but not least, to obtain the Holy Grail, which is the C mark, C mark with the MDR certification, you have to cope with the notified body. And as you know, notified body, it is particularly, let me say, complicated to enter in contact with those notified body, but also to deal with, because you have to share with us and present a dossier, and this dossier must be very well prepared before to discuss and present it to the notified body. This is just a rapid overview of what is the TRL booster dedicated to MedTech, but I think that you have understood that to go through this plateau, to go through this very critical phase to develop your product, we have established different workshops, exactly 10 workshops, and those 10 workshops cope with one particular team, which is related to, let me say, crucial or pivotal thematic within the development of a medical device. As I mentioned previously, the regulatory path, the QMS, the design and development with the different ISO, this one and this one, the GSPR, clinical evidence. As you know, there is only not a clinical evidence, but you have to prepare the material vigilance and post-market survey of your medical device. So this is also a team very important to be aware with. We have established a workshop that are particularly dedicated to software as a medical device or embedded software. Obviously, security and GDPR are also a thematic very important. As I mentioned, notified body, and also we during half a day we discuss about certification in other countries. So, in a nutshell, once again, this is what we offer to our entrepreneur. This is what we offer to all the company that needs to better understand how to reach the C mark of the medical device, product or services. This TRL booster are dedicated to the C-level management of preferably established company. It means that we prefer to invite companies that are already established in the sense that they must be engaged in the development of a medical device, and not only have an idea of a medical device, because the final goal is really, as I mentioned, to anticipate the problem and accelerate the development of this medical device. So all the company must be above TRL3 and CRL3. And this is not only for the WSL member, but this is open to any kind of company that are involved in a medical device development. I would like also to share with you 3 other initiatives, which is also launched in Belgium, which is the KredExi initiative. I think that you can scan your screen and upload the website of KredExi. If not, don't be afraid. I will share with you the website link in the chat. The CARICAM was launched by one university of Belgium, which is the UCL. And this initiative is a certification for, let me say, students, but that they are also open to companies. So let me say, people from companies, employees from companies. I think that is 1 year of formation, and you can be certified as a clinical affair, regulatory affair, quality assurance within a company. So if you want one guys of the company be a specialist in that field, you can apply to follow this university grade certification. In Belgium, we have also the Solvay Business School, in which they have developed an advanced master in biotech and medtech. But this master are mainly focused on, let me say, the business part of the things. So you will be trained to be a QR guys or a regulatory affair guys, but mainly to, let me say, be the future CEO or chief business officer of your company. I would like to notice that you have an introduction on this master the 22nd of this month. And once again, I think that you can scan your screen to go directly to the web page. The third initiative that I know is more a European initiative, so not only in Belgium, not a Belgium-based initiative, let me say. And also, this initiative is dedicated to a medical device product. So once again, you can scan, but I will put the link in the chat when I've finished my talk. So all of those initiatives can help you to better understand what is the challenge to perform, to establish, to sell a medical device, to launch a medical device in the market. And all of those initiatives will help you to, let me say, think better how to do the things in the right way. I forgot to mention that for the CARICA, you have also at the end of this month a presentation, an info session, let me say, a free info session. You can learn a little bit more about this formation. And I think that this is the end of my presentation. I don't know if there is a room for a question, but you have here my email, so you can send me email directly if you want. Thank you for your attention.
Thank you, Fabrizio. We don't have any questions yet, but maybe to ask from you. So this program that has been available, I think, for quite some years now, maybe you can also showcase some of the best practices or success stories that have come out during the program, because the program itself is for 6 months, right? I know that the last batch started from March, so up to October. So maybe you can also showcase about the success stories about the companies attending the program.
Yes, sure. And one of the best showcase is Liz Medical, which is a panelist just after that. Another well represent, let me say, a very good showcase will be Axelis Bionics, which is in fact a bionic food. Sorry, not food. Food. Those very young company follow this TRL booster program, and this program helped them to better understand how to label all of the different products that have been developed within the company. This program also helped them to better anticipate the further steps to have the CE mark, because I think 2 years ago when they entered the first edition of this program, they will only before the, let me say, first in human assay. Okay, so that really help those companies to better understand what it is the minimal requirement, let me say, to discuss with notified body and to launch their product within the market.
Thank you. And maybe you can also explain, so by the end of the program, so after 6 months, what is the outcome that is promised for the company attending this workshop? So in what stage they have reached by that time?
As I mentioned, this is a long journey to develop a medical device. So obviously this is not only in 10 workshops and in 6 months that you make a jump in your TRL or in your CRL. This is very to anticipate it, to prepare the 1 or 2 years development that you have to done inside your company. But let me say that when you were well prepared, you're not obliged to make some new trial. You're not obliged to raise money, but you have not enough money to go to the end of your clinical trial. And another thing that are important also, let me say, what we promise during this 6 months of training is that you can discuss with, let me say, 5 or 6 different experts within the domain. Different experts that are, generally speaking, consultant in MD, in MDR as well. And you can really discuss with them as we are in contract with them. It means that for a lower price, you have access to 5 different experts and you can ask questions that, let me say, burning question that will cost a lot if you have to discuss only indirect with the company. So this is probably the main important thing and the main benefit for all these young entrepreneurs that enter the program is the fact that you can really discuss about your problem, about the challenge you faced with some expert and a consultant that are working in a daily basis with all of those problems, let me say.
Thank you. And maybe my last question. So as you have worked with these companies over quite some years now, and you also have the background and expertise to support these companies, you have also seen what have been the challenges for the companies in the road of receiving this certification. So maybe for these Estonian companies who are listening today, maybe you can also highlight some of the key takeaways to keep in mind when you're entering into applying for this MDR.
Once again, intended use, which is really the first thing to deal with. It's the most important thing because it will determine all the path that will be choose to go to the market. So before any kind of development, just think really about the intended use. Intended use means what your device will be used for, and will be used by. So this is really the first question to ask and have a clear-cut idea about that. The second one is to have a good size of the clinical trial. It is not necessary to have hundreds and hundreds of patients to prove that you have a benefit. Just have a good size of your clinical trial is also really important. And for small company, let me say, don't be afraid to use CRO. CRO is a contract research organization, because those contract research organizations have the habitude to work with the hospital, have the habitude to work with medical company, and they have the expertise to speed up the process. So don't want to, obviously it costs very a lot, but you will gain time to not do all the things internally. And probably the third key take-home message, let me say, is be prepared with your technical file, well prepared with your technical file to discuss with the notified body. In Belgium, if your technical file are not well prepared and really complete, you will not be able to even discuss with a notified body. So be well prepared with your technical file. It's very, very, very important, because if not, you can have 6 months of delay in obtaining your 6 months or 1 year of delay to obtain your CE mark.
All right. Thank you a lot, Fabrizio. Really good points that you just mentioned. And I think next up we can continue on with our panel discussion. So our panel discussion moderator will be Ingeri Luik-Tamme, who is the attorney at law and healthcare lead at TGS Baltics. So Ingeri, the floor is yours and you're able to proceed.
Hello. Thank you, Marilyn. Happy to be here. Just a few words about myself. I've been an attorney for more than 20 years, and my practice mainly has focused on healthcare and pharma, and also health data and scientific research. So these are my main practice areas, and I'm very passionate about everything, that relates to life sciences. And also, I'm a proud mentor in the health tech field here in Tehnopol, and have advised several companies in different areas, wellness, also healthcare, also medical device field that has questions about regulatory requirements and are seeking solutions how to start the journey, or how to continue it, or how to overcome obstacles that they have faced. But let's meet the panelists now in alphabetical order. Laura Baroniene, Quality Manager and External Auditor of Lithuanian medtech companies. Welcome, Laura. Then Fabrizio Giannotta, who you already met, but it doesn't hurt to repeat that he's a MDR expert and in YSL incubator based in Belgium. And then Benjamin Mertens, a CEO of Lys Medical. And I understand you have a product, Iriscope, that is a minimized video endoscope, which helps the doctors to better see inside of the lungs of the patients and treat them more accurately and in a better ways. So happy to have you here and discuss more like foreign or international experience in this field. And I would like to start with you, Benjamin, because you are the one, the company, you're representing a company who has done it, who has gone through the complex processes of development, certification, and things like that. And I would like to know what is your experience in this? When you're looking back on the journey, what were the main difficulties or blind spots during the journey.
Thank you for this introduction. Indeed, it's a pleasure for me to share experience, which was quite interesting. And of course, it's not a straight way to success. So our journey started actually 6 years ago, and we founded the company at that time. And at first, we had an idea of a medical device that would be a Class 2A medical device. And then we understood at that time that it would take quite a long time to have the certification, especially since the MDR was about to be approved. And so we knew that the MDD at that time would be soon too late for us to apply to. And so we understood that it would be quite difficult. And so we decided, from a purely strategic point of view, to actually change our strategy and to say, okay, our device can be composed of several features. And what we did is that we cut the device into two main features. And the first feature is the miniaturized video endoscope. That is actually a Class 1 device. And so this helped us in going much faster in the process, knowing that the features for the Class 2A devices are under development. And so it means that doing that, we actually saved more than a year in the certification process with the notified body. Additionally, since it is a self-certification in Class 1, we directly had an access to the hospitals, and so we could start the clinical investigations quickly and with a very low cost, since a CE mark medical device can be tested actually for free in a hospital. And there is no need to have the ethical committee approval for the first trial. And so doing that helped us in, one, understanding the market, two, obtaining a lot of data. And these data are actually very meaningful and very helpful for the artificial intelligence layer that we are developing and that will come in the second version of the device. Three, we are actually building the network of users. And so it means that after that, the user will have the device already installed in the hospitals and will just come with the additional features that will have a high added value, and we can start directly. Of course, it's not very easy. So the main difficulties that we encountered were that, one, it is not because you are CE marked, and this is something that many people think, if you are CE marked, you can start to sell. No, it's not true. It's not true. You can start to sell if you have strong clinical data, if you have a strong understanding of the market, and good positioning on the market. And so what it means is that even if you have the chance to have a quick certification, you need to take time to size the clinical studies and clinical investigations to make sure that the outcomes will help you in reaching the market. And this is not the easiest part. And this is something that needs to be explained and needs to be discussed with your shareholders to make sure that the timing is clear and the outcomes are quite clear. So this is the first challenge. The second challenge, the certification of a medical device is, of course, a lot of difficulties. Since we have an electronic part, we have certification of the 60601, so the electro test. It's not easy. It takes time. And for us, it was during COVID, so it was really challenging. So this is the second challenge, making sure that you have all the data, all the papers to have your device certified. And I would say the third challenge and for us it was really difficult because we were in COVID. Your device is useless if you don't do it with the customers. And the customers is not one physician, it's 10 physicians, at least in 10 hospitals, to make sure that even if one thinks in one way, they all agree that this is what is important and this is what is not important. So the 3 challenges is 1, the certification, that is actually in 2, the timing that we discussed with the shareholders, and 3, to make sure that the requirements and the specifications that you have are actually the good product market fit.
Okay, thank you for this very, very good practical insight. I understand that sometimes you can go into this process with the one idea and one strategy and, like goals and product. And along the way, sometimes you have to change things, change plans, amend accordingly, and be ready and flexible. And I think you were quite lucky to have this advice from early on. So this was all possible in due time, and you didn't waste too much time, going one way and then changing it afterwards and doubling work in some areas. As I understand, you had good advisors then how to approach this. To start with one feature and then add on later.
Yes,
right?
Exactly.
Yes. Thank you. I would continue with you, Laura, as you are a quality manager and external auditor for different companies, I understand. So, and your aim, in a way, is to be picky and find problems and detect them and help the companies to overcome them. What is your experience? What are these the main issues the companies struggle with?
Thank you, Ingrid. I'm Laura, head of quality and one of the leading medical device company in Lithuania, in Sofnet, which are development medical software. And also I am the external consultant in medical devices quality management system and MDR. First of all, I would like to say that I am very happy to have possibility to participate in this workshop. And also it's very nice to hear some success and inspiring histories, such like Benjamin said. And a little bit about myself. My personal journey started more than 20 years ago in business consulting sector, where I worked with the quality and tower management system implementation and organization based on the international standards, ISO, as well as also third-party auditor in the teams of the biggest companies in Lithuania, such as Veritas, Systemų Registras, etc. After 10 years implementing and auditing experience in different areas and doctor degree in social science, I decided to choose my main fields, which are most interesting for me, and went to the medical devices. Organization where I started to work before 8 years, Sofnet, was one of the first organizations in Lithuania which have received product certificate on medical device regulation, and it was in 2020 first year. And now we have almost 10-year experience with the medical device quality management system in accordance with the international standard ISO 13485 implementation, also with the MDR implementation, and our medical device quality management in different countries such as USA, Canada, Brazil, etc. Implementation and medical device registration experience, also clinical investigations, organization and management. The list of my activities is constantly expanding, and I work also as independent consultant and auditor in MDR field. And my experience is in medical software as a specific type of the medical devices, but I also work with other types of medical devices. So in general, my experience is related with the practical implementation, how to create documents, how to use additional standards, guidelines for the correct understandings of MDR, and the best preparation for certification. So I'm not this person who is looking how to find a problem, but I'm that person that analyzes the situation in organization and helps them to make a good plan how to reach the goal, the MDR certification. And from my experience, I saw that one of the biggest problem is lack of the specialists which have experience in MDR implementation. So I hope that you all know that MDR requires very competent specialists for regulatory compliance because the scope of MDR must be included also additional guidelines as MDCG and etc. So this person should have not only qualification but also experience. Another problem is insufficient medical device traceability in the design and development, manufacturing and delivery to the customer processes. As our colleagues mentioned, if the technical file is very well elaborated, so it could be seen that you reach some part of your goal. But if the traceability is not insufficient, so organization will have problem with the technical file, with the technical dossier, and with the certification company. Talking about the certification companies, you are not alone on this world, and they are they have also problems with the personal qualification. And I think you know, but not all the organizations which had accreditation regarding MDD now have accreditation regarding MDR. So if you are planning not only to implement MDR but also certify, you should look in advance and you should talk with the certification organization, with the notified bodies very in advance, and should plan this timesheet for certification activities. Another type of the problems are clinical investigation, which also must be planned in advance because it takes time, first of all, to receive bioethics approval, and the second part to implement correctly the clinical investigations, because the scope of clinical investigations always are very big, because you should ensure reliability of the results, and the value for the patients should be clearly stated before the approval of clinical investigations. My additional advice to the organization would be to learn about risk management. There are some standards which are related with the medical devices risk management. I will share these standards to the panelists after my talk, but they are very important to organizations seeking to understand what else, not only traceability from the requirements to the testing results, must be implemented in organization during the MDR implementation. So it would be just summarized information. Thank you.
Yeah, thank you. I think we have noticed this as well while preparing for our clients, for example, for MDR and compliance with MDR, that there really, in some countries especially, are not specialists available. We don't even have anyone to hire to cover this function in the company. So thank you for mentioning it. And I think at least in our corner of the world, the companies also must think through these practical issues that they should prepare and seek advice or information who are actually available and who could they hire to fulfill this function in their company, because it is really required, and compliance otherwise is not possible. And now to you, Fabrizio. You already mentioned like intended use that the companies have to figure out even prior thinking to going to development and further steps in the process. But do you see any other problems, blind spots that the companies you are helping with during your program, which repeat from company to company?
As it was mentioned, and I would like to stress again those points, is the time and money, because they always take more time than we plan. Because you need an ethic committee, because you need to engage nurse, because you need to engage surgeon within your project. And obviously all of those guys, all of those people are involved in your day-to-day life, so they don't have additional time, let me say, to be involved in other companies. So it means that it just only for that it takes time. To recruit patient, it's very often very painful. Because even if you recruit patient, some patient unfortunately die during a clinical trial. Not because you use your device, but only because this is the life, you know. But also some patient want to stop the clinical trial. So this is very tedious for a company, and particularly for a small company, because you don't have a lot of money. So if you plan to have, let me say, 20 people, 10 female, 10 male, for example, just as an example, and if you have the money only to make 20, if 50% of those 20 people leave the clinical trial, you are not in the scope, and you have not enough data, as Benjamin mentioned. You have not enough data to be statistically relevant and to present some data to the surgeon or to authorities or notified body to launch your market. So Laura mentioned also the clinical trial. It's very, very important. It takes time, it takes money. So another advice that I have, and I'm, let me say, often cope with this problem with all the company that we coach within the WSL, is that you make your plan, you have your development plan, and you evaluate that you need 1 million to perform the different plan. Just put 20% more in money, because you always need more money that you have planned. Just because of the delay, just because you have to hire another people or hire more patient, blah, blah, blah. So just to have once again, the take-home message is have a buffer. Have a buffer in time and have a buffer in money. Probably also, and Benjamin will be in agreement with me on that, is be well, sorry. Another important thing is to have a good scientific advisory committee with some key OL and key opinion leader in the field. When you're a small company with 5, 6, or 10 different people, generally speaking, this is a young people in startup company. To be accompanied by KOL in the field is very important. KOL can give you some advice on the development of your product. Benjamin mentioned discuss a lot with your shareholders. So you have this advice from the KOL, but also if the KOL trust in your project, you have also a better image of your company. You can also share a better image in the market of your project. So let me say it's a little bit related to communication, but communication and marketing is also important now, even if you are a small company. And it is particularly important because you don't have million and million to spend in marketing, such as the big company is. Yeah.
Yeah, thank you. Again, absolutely practical advice, and I would only ask a bit more in detail about the clinical trials. In the market, you can hear that maybe some countries are better for conducting clinical trials. Do you have any thoughts or comments on that? Is Belgium, for example, or Lithuania known good places to conduct it, or how to even decide in which countries to conduct it?
Unfortunately, I don't have much experience in that field because on the one hand, the company that are coached about WSL are pretty young, so many of them never reach or don't reach the clinical trial, and then they are out of their incubator system. So they launch and they manage the clinical trial by itself. And on the other hand, I'm generally speaking not involved in this clinical trial aspect. I mean, in the practical field. So unfortunately, sorry, but I can really answer and I can give you practical input on that, or valuable input on that.
Benjamin, Laura, do you have anything to add? Or
Yes, I would like to add that even small countries are very good partners for clinical investigation. Because my experience shows that all investigation which are conducted in Lithuania was very well prepared and approved from notified bodies, which are in our cases mostly from Poland, because Poland is near to the Lithuania. But what is very important, seeking to know that all documentation about clinical investigations are very well prepared. There are also additional standards which are very useful to go through the standards and the documentation. And if the documentation is fully prepared, then no additional questions from notified body are asked to the organization.
Yes, if I may add, actually, I will first jump backwards on one thing that has been said. It's important to work with the KOLs, but I would say not only. Not only because the KOLs, it depends on what you want to build, what you want to sell, of course, but usually the KOL is not your customer. And so it means that the KOL is important because he will be very enthusiastic about doing publications, doing scientific papers to say that your technology is cool. But if the KOL does not work as the user, that will be your customer, then there is an issue. And so it means that in List Medical, when we talk about the users, we make a difference between the KOLs that will publish papers that are quite important, we all agree with that, and what we call the champions. And the champions are the real users, those who are really convinced that your device has an added value, and that if they don't have the device anymore, they will lower the quality of the healthcare that they provide to the patients. So this is the two things that are important, and I think that one that wants to develop and put a medical device on the market needs to be aware that you need more than keywords, you need users. Two, about the clinical investigations, I would say that it all comes to the market access. If you do a clinical investigation in Estonia, for instance, depending on the pathology that you want to diagnose or to treat, you will prove that your device works on Estonian people. That's the first thing. The second thing is that in every country, the expectations are different because budgets are different, because the way the healthcare systems are organized are different. And this all comes back to what do you want to prove? And so to know what you want to prove, you need to know your market. And so it all comes back to say, okay, what I want to prove is actually dependent or not on the country, because of course, some things will not depend on the country, but others will. And so it's important to make sure that the clinical investigation that you want to do, of course, start in your own country. That's very easy, of course, do it. But after that, quite quickly, you need to contact the KOLs in the relevant countries that will help you in defining the clinical investigation that will demonstrate that you have a demonstrated clinical benefits that is applicable to a maximum of countries. And so for that, you need to have a good segmentation of the market.
Yes, I agree. And I feel that we are getting so much good information here. How do you feel, or how do you think, where could the companies who would like to know more about all the details about clinical trials, about how to approach this intended use problematics and other questions, where can they get support? For example, Benjamin, where did you get all this good advice and support while starting and developing your strategy?
In French, we say, on s'est cassé les dents. So it literally means that we broke our teeth. It means that you need to fail. So where did you get the advices? Actually, we learned a lot by ourselves. And how did we do that? We went on the field, because whatever the answer you need, it's on the field. All the answers are on the field. If you want to know what is the clinical benefit of your device, and I can guarantee you that it's not what you think on the first hand, never, you need to go 3 times a week in hospital with the user, at least 3 times a week. And this is where you can understand that he will say, okay, I know another doctor who works in another country, and in this country, it works like that. And so then you understand that if you want to prove that it works in this country, maybe the clinical investigation that he's doing right now is not the good one. And of course, networking, talking with people, but the short answer is on the field.
Learning by doing, in short.
Yes.
Yeah,
that's the best way to learn.
Yeah, Fabrizio, Laura, do you want to add anything? Where to get this good advice and support to know how to do this?
One of the best things in our world is the possibility to share knowledge and make it fast and easy. So I would like to pay attention to the wider community, which is not limited to your country facilities. And I would like to say that the most valuable connections are between the organizations which are working in the same area. But in some cases, such organization would be the competitors and don't want to share knowledge. So in this case, valuable are also organizations which have the same role as defined in MDR. For example, different medical devices manufacturers, different medical devices distributors. Another point to choose most similar organization, look to the same risk class and intended use as similar as possible. So such organization could share with you some knowledges if they are do not try this as a confidential information. And I think that closely working with community, you may come to the untypical decisions for your product and your own decisions for the MDR implementation. Also you can share with another organization, and another organization can share with you the usable contacts. And it's also useful for organizations.
And I wanted to actually add a little something. Actually, it all comes to the governance of your company. If you have a good scientific advisory board with good chosen medical doctors that you know that represents what you want, where you want to be. So if you want, you can have one American, one Japanese, one French, one German, and then you can have a good idea of what will be a good vision of your technology. But it also applies to the board of directors. And I highly encourage you to find in your board of director someone who has done it already, someone who has already put a device on the market. And this really changed everything in the approach.
Yeah. Fabrizio, what about your program? Do the companies have the possibility to interact with each other? Because I understand that, you know, if I talk to anyone like lawyers from other countries, companies or clients from other countries, they quite often point out that in Estonia, the community, they have heard that in Estonia, the community is quite close and everyone is helping everyone. So I hope it's the same, you know, in other countries. What about Fabrizio, in your program? Do the companies exchange experience?
Yes, absolutely. And this is what also we have established the TRL Booster MedTech edition in such a way that companies that are faced with the same problem, let me say, or the same issue or the same challenge. I prefer to talk about challenge rather than problem. A company that are faced with the same challenge can discuss together. So within the TRL Booster, in the morning you have, let me say, the theory, and then in the afternoon you can share experience. You can discuss about issue with expert, and company. We have pretty young company, but also company that are quite close to the clinical trial, and company that are close to commercialization. So all of those people that are, let me say, at different level of maturity can really share their experience and all the problem that has been solved, as Benjamin mentioned, because il s'est cassé les dents. They try by themselves in the field, and once again, I really would like to stress what is just said by Benjamin. Get out of the building. Get out of the building to go to the hospital, to go to a surgeon, to practitioner, whatever, to test your ID, to test your product, and to be sure that your device will fit with any kind of surgeon in any kind of land. Because don't think that a surgery is done exactly at the same way in each country. Regarding the networking, as I mentioned, okay, TRL Booster is a room where a networking and exchange can be done, but as I mentioned in my presentation, because now we are managing the MedTech Wallonia structure, we also would like to open some space, some room to all the stakeholders to discuss about MDR. And when I mention actors, actor is obviously company, but also university, hospital, practitioner, nurse, patient, etc., etc., etc. And our aim is in 2 or 3 years to open also this community, which we'll name MedTech community. We would like to open this community to foreign countries, and because now we are in connection with you, we can open to the Estonian people and Estonian company, obviously.
Sure.
Because we are all in MDR. Remember that.
Yes, exactly. And of course, one issue I would really like to cover, in addition to what we have discussed so far, what also Benjamin mentioned, that, you know, all the community and things like that, information you can get online or other things, you know, where you can this generalized information, but you cannot be successful in developing a medical device without good advisors, and you have to pay for them, and you have to have money for clinical trials, for all the other things. So one key issue is the funding. Do you have any good advice or knowledge of support available, how to get the funding and where to get it?
Well, the good news is that there is a lot of money. And people will always have money if you can treat their illness. That's the first thing. But it is clear and true, and I will not surprise you if I say that 3 years ago, if you had like preclinical results, if you asked for 100, you had 500. Now today, if you have almost clinical results, you ask for 100, you have 20. So the context is different. So the challenge is to have money is actually what an investor is someone very rational. And there are usually two phases. The first phase is what we usually call the seed, with sometimes what we call the fourth friend and family, when you need to find the first euros. And I would say this is extremely strategic, because do not think that if you can raise, I don't know, 500,000 euros, you will find the rest easily. Because you need to make sure that the money that you have will open the doors to the next funding stages. And so you directly need to talk with the investment funds at the first stage, asking them, what do you want to have to invest in 1 year, 2 years? To make sure that you can fulfill the expectations when it will be time to have larger amounts to be raised. That's the first thing. The second thing, investment funds are quite smart people, but they have a lot of files to analyze. A lot of files. And there is a lot of competitions between the startups. And so you need to understand that they want to lower the risk and increase the revenues. And how do you control the risks? Is by showing that what you do is reliable, based on facts and not on dreams, and that you can deliver. And for that, the answer is on the field. So collect as much data from the field as possible, as much. And then you can structure it to present it to investment funds. But for that, you need to prove clinical results, if possible, sales, if possible, or at least maybe 10 users who would be really enthusiastic in using your device. And if you can have a prototype that can be tested in a pig or something like that, it's good. But you need to show that it's not only dreams, that you have facts that you can prove.
Sure.
And that's my recommendation.
Yeah, thank you. Fabrizio.
Unfortunately, nothing additional to add to what Benjamin just said. It's a tough business, particularly right now. I will not say that it's easy. You must fight to find money and to raise money. But obviously, that's true. There is a lot of money, but many of investors don't want to take too much risk at this moment. But don't be afraid. There will come again good times. We just want to wait for the moment. And unfortunately, for many of our company that are coached by a WSL, sometimes it's they run away because they don't find any much money to complete their round. I don't know how it is in Estonia, but in the Walloon region, we have a lot of grants that can help company. even to perform a clinical trial. The company can apply for grants in the seed level, let me say, and development level, even if scale-up level. So there is a lot of possibility, but because the budget is not extensive, we are now required to go to the Europe to apply for grants. So not to stay only in the Walloon region. There is possibility, obviously, still possibility within the Walloon region, but the Walloon region asks us as an incubator help also the company to go to Europe and to apply for grants, H2020, EASi, etc. This is also an opportunity to work together to enlarge the network, which is really important. Once again, we are all MDR. We are all, let me say, in the MDR field. So it means that when we have DC mark, we normally are able to sell in all the European country. But unfortunately, it's not true because all the country works differently. So if we are able to build and to increase our network and to, let me say, enrich the network of a very big medtech community, I think that the things will go better for the people, I mean, for patients, for hospital and for doctors as well. That's my thought for the coming years.
Thank you. Laura, do you have anything, any thoughts, any experience, any stories you have seen?
Yeah, in Lithuania, we had some grant programs for acceleration activities, but as far as I know, they were applicable only for organizations which are creating the product, not for this organization which already have product. So the certification was a part of these products. But I have good experience with the companies where investment was received from the potential partners and big customers, which were very interested in the organization development of medical devices, and this part of resources was very useful for such organization to finance clinical investigations.
Oh, great. That is a great idea. And a bit a different approach, I think, also to get the money from the potential clients. Okay, but do you have any inspirational thoughts after this, talking all the difficulties and all the complexities that the processes involve, and the money issues, and you have to find resources to do to go through all the processes. Why should the young entrepreneurs and newcomers still do it?
My experience shows that all organizations could finish on their journey successfully. Only one. It's very important to have good elaborated plan and qualified team to implement all requirements. And if you have strong specialists, legal specialists, relation with clinicists, and deep knowledge in your medical devices, you already have a part of success. Other things is only continuous and systematic work. All goals are reachable. So I would like to wish organization very, very big success in your journey.
Thank you, Laura.
Perhaps I will also add the fact that, nobody is perfect in this land. So I just like to say that obviously we talk a lot about problem, about issue, blah, blah, blah. But I think that as an entrepreneur, the most important thing is that you must be passionate. by your company, by your product, and by your market. Benjamin said market is very important, and yes, it is, because within the market you have the patient, and you have the patient that you want to help. So healing the patient is probably the most challenging things, but the things that make you to wake up every morning to go your work. So be passionate, and you will succeed, as many other companies do, because they are passionate by what they're doing.
And I will even go further. I mean, if an entrepreneur works for money, he will fail, because it doesn't matter what you do, it doesn't matter how you do it, it means why you do it, and it needs to come from the guts. Otherwise, you won't have the energy to go through the end. And I would say that usually startups are in the technical field. And, one day a surgeon told me having an engineer as a patient is awful, because the engineer always wants to understand everything. And what we learn in university, or at least is what I learned, but it was 20 years ago already, is that you need to build devices and you need to make sure to understand if they work and why they don't work if they don't. So you need to understand what is wrong, what is right. But remember that at the end of the tunnel, there is a patient. And the patient, it doesn't care how your device works. It doesn't care if you know why it doesn't work. He cares to know if it works. And this is the whole journey. This is why the certification exists. This is why you need to have guts. This is why you need to fight. And this is why you need to know why you work and not what you do. And so this is maybe the most important thing. And the most challenging thing, if I can give one final advice, is that the hardest thing that we have to manage as entrepreneur, it's not the team, it's not the notified body, it's not the customer, it's yourself. Because you will face challenges, and be ready.
Sure, thank you, Benjamin. So everything is doable if you have the passion and if you have a good team and good advisors, and everything else can be solved if you really want it. And thank you. I loved today's conversation with you. We had so many practical tips and ideas what to use in these processes. And thank you for taking the time and sharing your experiences and thoughts. Thank you so much. Have a nice evening.
Thank you. Bye-bye.
Thank you. Bye-bye.
Thank you. I just left my email address in case of questions. Bye-bye.
All right, so thank you for joining today's workshop. This was in collaboration with the Estonian Health Insurance Fund, Enterprise Estonia, and the Estonian Health Board. And this won't be the last workshop, because I'm sure we will have these kind of collaborations as well in the future, because the interest is very high from the companies and also from the public organizations. So stay tuned, and I will also share with all of these materials with all of the attendances as well. Thank you for participators, and thank you for all the speakers, and have a nice evening.